Welcome, dear viewers, today on our health television. The phrase, "my doctor finds nothing, my blood count is fine," however, and many patients really wander around in circles trying to find their way to health until at some point the statement comes up, "It must be psychological." Do you want to break out of this cycle? For that, I have really important doctors with us today who are able to look beyond the horizon, recognize the connections, and also inform us today about which blood values are truly meaningful, what matters, and how we find our way to self-regulation. Stay tuned. Hello everyone, nice to have you both back. I mean, the viewers know you by now. Dear Thomas, as a pioneer of biological medicine, and dear Jürgen, you have already given us so much insight into neurotherapy, but where can one even begin? We just said in the preliminary discussion the sentence, "Everything is fine with me." The complete blood count is fine. Patients are now at a point where they are immediately doubtful. And one has the impression, is a doctor even still able to read a blood count? And is he even still able to decide on a specific disease pattern, which blood values really play a role here? Without then, as we have often talked about, simply hitting any symptom-covering chemical sledgehammers in this machine medicine to now give a comprehensive view in the provocation. So, dear Thomas, I would like to start with you. What does a complete blood count mean? And what significance does it have for you when a patient comes to you and says, "My comprehensive blood count is fine, my doctor finds nothing"?
Yes, thank you very much for allowing me to come here at all, to speak once more. When we look at our patients who come to the Sonnenberg Clinic Health Center in Schwelbrunn, Switzerland, where we practice biological medicine, then I must say most cases or very many cases are unclear. And they come to us after a long odyssey. We have done all the clarifications and nothing is found. Very many then tell me it's all just psychological. Go to the psychologist. That is a massive fallacy. A massive fallacy. It was not properly investigated, and that's why the problem was not found. Increasingly today, people are functionally ill. That means systems are diseased. The immune system, the allergic reaction system is sick. The microcirculation system is disturbed. And for that, neither the small nor the large blood count is of any use. We looked, so our marketing woman looked, what is the most Googled disease? Not COVID or depression, the modern stuff. No, over the years, it is irritable bowel syndrome. These people are massively disturbed. So just in this example, massively disturbed, constantly in pain, constantly have head problems, maybe headaches, maybe they can't sleep and have stomach problems. They go to the so-called specialist. Yes, he looks at this and that, does a blood test, finds nothing anyway, maybe checks liver values, finds nothing there either. Then he does a gastroscopy, does a colonoscopy. Is mirrored from below and from above. So many patients have that. Nothing was found, but they are severely symptomatic.
We will continue shortly, dear viewers. But at this point, we would like to present you a few highlights from a very special program. And if it excites you as much as it excited me, then click on this show, watch it, and take these messages with you. All the best, and until another time. Goodbye, everyone. it must be forbidden for everyone to still be allowed to express themselves publicly.
Well, the French have gone so far that they even impose a rather heavy fine. 15 €0 if you criticize a medical measure that others find supposedly good.
Yes, by the way, this was also said in Davos. It is much, much more important to prevent the spread of fake news than to worry about the climate or to care about the war in Russia.
They did not examine the small intestine. The system of the small intestine was not examined. Hat man nicht untersucht. But there are tests for that which are not done at all. Die werden aber gar nicht gemacht. Blood tests are done and often reimbursed. It's always about reimbursement. Some are not done at all, but that doesn't help. Auch werden gar nicht werden gemacht, aber das nützt nichts. Man trifft not the actual problem.
Can I determine these small intestine values in the blood, or do I really have to take a stool sample? Or would shall I say, a conventional doctor who is bound by insurance at all be able to access these values?
Every doctor, I am also a normal practicing doctor, and my dear colleague Stein too, we have our practices. Auch wir haben unsere Praxen. Like another in I don't know where to. Auch. They could do it too, but they would have to have the awareness of systemic diseases. That's the problem. Our medicine has become extremely reductionist. That means it is clarified so mechanically, but not completely. There is the tinnitus, there is the macular degeneration, there are all the autoimmune diseases, which idiopathic means one doesn't know a cause, none is found. That's not true. One would find causes if one would clarify more broadly. Your question about the small intestine? Yes, there are blood tests, but also in the stool we do both. And most importantly, we test the autonomic nervous system, because the fine regulation of all metabolic functions lies in the organization of the autonomic nervous system. Stoffwechselfunktionen liegt in der Organisation des vegetativen Nervensystems. And these people, I'm sick and nobody finds anything, were not clarified at all. Dazu gar nicht abgeklärt. We do the testing and we find a massive disturbance of the balance between the parasympathetic and sympathetic nervous systems. One regulates that again, especially with intestinal therapies and milieu therapies. And then the people feel good. 10 years of stomachache, no more stomachache. So, as an example.
Yeah. Now, I have the question for you, Jürgen, because you obviously see both sides, how it is to be in practice and try to help a person, especially in the old insurance system, still in the German-speaking area. What changes are needed in the consciousness of the patient, but also in the consciousness of an insurance doctor? I have the feeling that we are slowly reaching a point where the cup is overflowing. The patient is chronically ill, we have new disease patterns that a conventional doctor has never seen before. And on the other hand, the family doctor also notices, I'm sitting here and if you take away antibiotics, ibuprofen and cortisone from me, then I have a problem.
Yes, I would now also like to defend the colleagues a bit.
It's not about criticism, it's about where I reach the limit and how I go beyond that. It shouldn't be criticism from my side, but it was directed in such a way that ultimately only the tools are available.
Some of my friends are practicing doctors, and I know the worries and concerns from the colleagues as well. The problem is they are virtually forced into a system which is now increasingly bureaucratized.
They get less and less time with patients ultimately. The times have become minimal for patients to see the doctor. So in the short time he sees the patients, he has to plan proper therapies and also perform diagnostics. I think for many, it's really the case that they would like to do more. I have also done this myself for years in my own practice in Germany. It is quite a balancing act that one ultimately has to manage, because I had already practiced biological medicine in Germany, and I had also been a general practitioner. And this combination is very difficult, and even my friends say that it is extremely difficult. And in recent years, this has intensified significantly. I don't believe that the problem is ultimately due to a lack of motivation or that the awareness of it isn't sufficient, but I really do think it's about what can the colleagues in the situation they are in still significantly improve.
Das ist so, was können die Kollegen in der Situation, in der sie sich befinden, jetzt noch viel verbessern?
So due to the external pressure that is imposed. So ultimately, in my opinion, it is a political question of what kind of health system we want, how effective it should be, and accordingly it should be designed.
Dementsprechend sollte man das auch gestalten.
Yes, I also think to some extent, especially in the current times we are in, it might also be about a new network of patients and doctors forming, one that doesn't wait for politics, because I have little hope that anything happens for people. That one really says, okay, how do I as a patient achieve regulation? I also see it when I talk to doctors who have their own practice, who say, I don't have the time to continue educating myself in such a way that I can achieve success with the patient using the knowledge. I am so limited in my time. And when I'm allowed to do a points-based training in alternatives, then it's so ridiculous because I can't do anything with it. With that, I also can't regulate a patient in a holistic way. So it is frustrating, of course, when you talk to doctors who are stuck in the system, because you do not yet have the knowledge to open a holistic practice, because you simply still lack the skills. And on the other hand, you do not have the time. And then you first need to regain the trust of the patients. So it is indeed quite a challenge.
For me, it was like this. I had to make a decision at some point. That was before I switched to the biological field. Ultimately, how do I want to work? And also due to all the regulations in public healthcare, ultimately, especially in Germany, it is like this. Fortunately, in Switzerland, it is still significantly better, but you can unfortunately already notice the trend. That is what it comes down to, whether I ultimately want to manage patients or if I really want to treat patients. That is also the personal satisfaction that ultimately comes into play. So if you have treatment successes, it is of course also wonderful for the therapist. And there's nothing more beautiful than when you can help a patient who comes to you with complaints. Yes, this is a very difficult topic, and in the end, you have to make the decision for yourself and then accordingly also work in that area.
Und dann dementsprechend auch in dem Bereich dann tätig werden.
That would be my idea about it.
Meine Idee dazu.
Yes, we have two problems in healthcare. One is the decreasing time that the doctor has for the patient. You've hinted at that, and the bureaucracy behind it, that's really bad. Another thing, which is also very bad, is the specialization, the increasing specialization. People go directly to the specialist. The general practitioner is dying out. Yet the general practitioner would be the one closest to this holistic thinking. A great appeal for the general practitioners. Deep respect. Only the ground is being pulled out from under their feet. That is the situation. In the USA, I am very much in the USA. There is the specialist group that is by far increasing the fastest. No one would think that is functional medicine. The doctors who offer functional, that is systemic medicine, and then do further laboratory tests, really trying to address the systems. Only in the USA you cannot practice that, because then the therapies that would be necessary behind it are forbidden. Big pharma is involved there. But it is interesting that the awareness among the people, among the patients comes that there is something deeper in my illness that the specialist can no longer consider in his narrow perspective. We are back to the gut. You do a gastroscopy, you do a colonoscopy, everything is good. Yes. Your complaints, we find nothing. Yes, we find nothing. It wasn't even examined. Back to the autonomic nervous system. If you can approach the patient differently, I'm sorry, dear patients, much is unfortunately not covered. There we are again in politics, where you said, that means if you only want to do reimbursable medicine, then you submit to this bureaucracy and also to the narrowing of the whole medical view of humans. We are really in a very difficult situation. We also said we won't bill through health insurance anymore. So we do bill, but through the alternative rate, like naturopaths. But these are all such formalistic obstacles, hurdles that are set for us. It is important to consider people more systemically. And that's what we do. And then such chronic diseases, I mentioned chronic fatigue. I frequently mention in the USA adrenal fatigue, which is adrenal insufficiency. The inability to bear stress. I mention chronic pain syndromes. I mention long COVID. I don't want to go into this topic now. But there's much more behind it than just COVID. Behind it is a sick regulatory system of the human. And with all these ailments, there is always a massive weakening of the regulatory ability, the healing ability of the human being. And those can be stimulated again with holistic methods.
Yes, and I also find that beautiful about you. Alexandra is also coming. She's also a doctor with you. It will, and I would like to hear the difference from you again, Jürgen, because I know that you are also familiar with the systemic thought. And since we are really in traditional medicine, and I would like to hear that from you again, this statement that it's the psyche and one is sent somewhere to a behavioral therapist has absolutely nothing to do with it. When I say I have a regulation problem, I am permanently in the sympathetic mode because I have a fear, an existential fear. And where that comes from, there are methods for it, but they do not see that. Confront your fear and learn to deal with it. And I also find that we are sent down the wrong path in the psychological consideration of illnesses, which really bring nothing. It cannot be that people come and say, I was in behavioral therapy for 10 years and nothing has changed. Yeah, sorry, then it seems like this approach generally doesn't work. And you also include this area in the clinic. And it would be important to me, once again, for you to really say something about it, because it's also an important area.
Yes, of course. we see that, if I may go back to the consultation hour, we see that relatively often, for example, in the area of detoxification disorders, that it's quickly shifted to the psychological level. So we can already do that as well. See well. And it is, of course, just so psychotherapy is not psychotherapy. We do. So Alexandra Kotthaus with us is specialized in hypnosis. And our experiences are we have achieved good results in a very short time with these hypnosis therapies that Alexandra applies. Hypnose-Therapien, die Alexandra anwendet. We have very good patient feedback, and above all, it is also what patients tell me. Hypnosis therapy actually leads to good results in 1 or 2 sessions. Hypnose-Therapie führt tatsächlich in 1-2 Sitzungen zum guten Resultat. So it's not like I always tell my patients that they don't have to expect 100 or 200 hours of therapy, but that it goes relatively quickly into a concentrated area. Ins eingemachten Bereich geht. And we really do have positive feedback, especially from my patients. Positives Feedback, also jetzt von meinen Patienten. Ja.
I also always find it nice to consider this holistic approach. If we now take a hypothermia, it has already been said, with children a fever spike is also a developmental leap. Afterwards, they can do more, they are somewhere. What happens during a hypothermia? Anyone who has ever done one can, to some extent, I don't know if it's the same for everyone, but perhaps to some extent confirm you go through an emotional issue too, right? For some. Or did I just experience it that way?
Yes, you reach a different dimension of our therapies, like with hypnosis or with hypothermia. These are methods where the body's own regulatory system, the system to recognize what is right for the body and to recalibrate. Für den Körper zu erkennen und wieder einzupendeln. The two methods completely different. The hypnosis or the hypothermia. With hyperthermia, it's like this, where a fever is induced externally and the body goes into a fever reaction. In this fever reaction, the microcirculation massively increases, and each degree of temperature rise causes at least a doubling of the activity of the immune cells. Mindestens Verdoppelung der Tätigkeit der Immunzellen. The granulocytes, the lymphocytes, become more active. And these are the ones that recognize in the body whether something pathological is present. For example, a virus that simply dies chronically. Or a toxic load that previously did not react in the body's inertia is then perceived. Wird dann wahrgenommen. And the body recognizes these regulations again by itself. The patient comes out of hypothermia after 2 hours or so and has a lasting effect of at least 14 days because the internal soldiers were activated and have gone to clean up again. Die inneren Soldaten wurden aktiviert und die sind mal wieder aufräumen gegangen. So a massive metabolic activation through this quite simple therapy. In conventional medicine, I am very well trained in conventional medicine as well. It is only suppressed and not stimulated. And any disease can, or most diseases can be improved by stimulating metabolism and the body's self-processing ability. And that is hypothermia, or also hypnosis on a completely different level.
Nice. I would like to discuss the holistic approach to blood tests again, because I found it very, very nice to see when a doctor works holistically.
Sehr schön zu sehen, wenn ein Mediziner ganzheitlich arbeitet.
How he can draw conclusions and correlations from blood values about the patient. Where sometimes I think nowadays a doctor gets his blood test with his bar and then sees what's within the normal range. But he no longer has this holistic view. Even from a comprehensive blood test, you could read a lot if you still had this tool.
Wenn man dieses Werkzeug noch hätte.
So maybe you can say something about that, Jürgen. Because I believe that awareness is now also missing among patients.
Yes, so you're right. This bar chart representation, it's terrible. And really, so even with traffic light colors, and if it's in the green range, you take a quick look, then everything's fine. But you can also, especially in those cases, sometimes it comes down to, for example, reading between the lines. So also what, for example, the erythrocyte size. So now we are there. Not of the opinion that it necessarily should be 100 at the MCV. So we react already at a level of 90 and would give 12 so that the erythrocytes do not enlarge any further. For example, one can already draw a conclusion about the supply of vitamin B12 or folic acid. But all of this assessment still takes place within the so-called normal range.
Exactly. In the complete blood count, one could read that out if one had learned what the blood count is supposed to tell me at all.
Was überhaupt das Blutbild mir sagen soll.
Except for the bar recognition.
So it's not just the erythrocytes and leukocytes, the blood cells, but also the so-called profile, or we call it a profile or chemogram, which many doctors do. And this shows the liver values, it shows the pancreas values, but they are not properly assessed. And we have the wrong normal values. The normal values are way too broad. They follow a Gaussian curve. The so-called normal values, and they are so broad that even people with metabolic disorders are still within the normal values. But if 2 or 3 normal values are here and 2 or 3 normal values are there, then that makes the red lights flash for us, because then you can already see, whoops, there's a metabolic disorder behind it.
Da ist aber eine Stoffwechselstörung dahinter.
Yes. Is one even still capable of learning these complex blood profiles? So we're only talking about the complete blood count now. And that's already being interpreted far too simply, because the deep, complex correlations that this profile could actually bring are no longer being taught.
What I'm saying now sounds arrogant, but it isn't. Rather, it corresponds to a necessity. A necessity. So we offer courses on this. Biological medicine, the basis of biological medicine. And it includes, I almost regret to say, the physical examination. How does the doctor examine a patient? Many can no longer do that. We have many young doctors who come to us as interns. Then they play mouse with me during the consultation and are amazed at how one can examine a patient. Whether someone has a cruciate ligament problem or a hip osteoarthritis, you can easily determine with the examination. That doesn't need an MRI. And whether the stomach is good, that doesn't need an endoscopy.
Also, aber das wird entlernt, nicht gelernt.
Unlearned in studies. People only do special examinations so that they go into this narrow medicine of specialist medicine, because the specialist then has the best medications for the disease instead of doing something for the body.
Gegen die Krankheit, anstatt für den Körper etwas zu tun.
We just go into a completely different mindset behind it.
Ja.
The blood count is just one.
Ist ja nur eines.
We learn, we teach our colleagues how to read it.
Wie man das lesen soll.
Very nice.
Yes, and especially in the area of clinical chemistry, like for example the liver enzymes, when patients say that's just a minimal increase. But if you consider that an increase in liver enzymes only occurs when 70% of liver cells show morphological damage or other early warning signs, like when cholesterol goes up or triglycerides go up, that can definitely be a point to react.
Das kann durchaus schon mal ein Punkt sein, da eben zu reagieren.
Ja.
So the idea is to relearn how to read the blood count as a whole, because if I understood you correctly, the comprehensive blood count is already meaningful if you're still able to make connections and have background knowledge of how various values change and how they interact.
Werte sich verändern und wie die miteinander zusammenspielen.
And then also how it can be treated. A very interesting side effect. We treat our patients who come to us because of some serious illnesses. They have our metabolic therapies, for example, for cancer, for autoimmune diseases, for neurological diseases. And they say, yes, what kind of medications do you have? Yes, cholesterol-lowering drugs. Let's leave that for now. After all, you are coming because of something serious. So let's treat that. And then we do our treatments. And after 2 weeks, the cholesterol levels have normalized without the anti-cholesterol medications, without the statins. Practically in all cases, in 2 weeks, even though we have discontinued the medications.
Sogar abgesetzt haben.
So when it comes to metabolism, we always talk about the internal milieu of the person. When we address that, the body regulates itself again.
Das Angehen reguliert sich der Körper wieder aus.
Yes, nice. I mean, sure, one could open a new can of worms here. Cholesterol as a building material and why, yes. But nice that you were here. Thank you very much for the holistic view, and I hope that we've motivated many viewers. Certainly our viewers are so aware that they already knew a lot. But often we have people in our circles whom we want to help and think, my God, they can't just rely on these statements. And this label with the psyche is just a misconception. Thank you very much. Nice that you were here. See you soon.
Thank you too.
Dear viewers, wonderful, comprehensive view again in depth, and the wish, of course, that many doctors start to look beyond their own horizons, to understand the human as a whole, and can also redefine their blood values and recognize connections. And for that, I thank you very much for watching. See you soon. Bye.
Thanks for watching Swiss Health Television QS24. Please don't forget to subscribe to the channel down here or watch all our programs ad-free via Wikisahnen or watch this selection of programs. I wish you all the best until another time, and goodbye everyone.